Okay. I took myself to the doctor, and he naturally did his things, and he's like, no, but there's nothing wrong. Then we sat down and we started talking. That's when he asked to see my wrists. I showed him my wrists. There were still cuts there. The cuts, they were old cuts, but you could still see them. And he was like to me, so what's going on? And I'm like to him, but there's so much going on, but I can't explain. I don't know how to explain these things. I want to talk, but I don't know how to talk. But then when someone wants me to talk to them, I don't want to talk to them.
Yes.
So that's when he said to me, like also Zaki said, he asked me questions about these 9 things that make you qualify to be depressed. And it turned out that I had most of them. And he said, you realize that you are depressed. And I was like, no, but this is something I felt for years. I don't see what's wrong. So longer time I didn't take medication. I refused to talk to anyone. And when I went to him for the second time, I told my family. And they were scared because they didn't know what it was. I feel like most parents don't know what depression is or what it means. So they were really scared.
Yes.
And
yes.
Till they, I don't think they understand how hard it is as a person to pull yourself out of that.
Wow. Let us go in I will come back to you and then ask our professionals, but let us engage with people from our social media platforms. Dr. Nzwaki, is there different types of depression?
Different types?
Yes, the Nero from Lesotho is asking whether if there are like different types of depression.
Okay. I'm sorry that I'm gonna get a little bit technical and scientific to answer that question.
Yes.
So depression, basically, major depressive disorder falls under depressive disorders. So yes. Depressive disorders then is your major depressive disorder. It's your depressive disorder due to another medical condition. Let's say, for instance, diagnosed with HIV or you have diabetes that is not controlled, then you become depressed from all of that. You can have substance-induced depressive disorder. For instance, somebody who's been abusing alcohol for long, when they stop, then they become depressed. Or someone who was on some kind of medication that made them happy, when they come off of that, then they become depressed. And then major depressive disorder on its own then has a little bit of subtitles underneath. For instance, melancholic features means you're just always so tired, you feel drained all the time, you just want to lie down and not go anywhere. You've got your atypical depression where you eat a lot and you sleep a lot, instead of the typical depression where you don't eat and you don't sleep. So those, and then there's one that comes during pregnancy, when you give birth, or after you give birth. That one we say it's during the peripartum onset. So that's what I'm saying, it gets a little bit technical. Yes. And then you get what Unalinda described, what we call persistent depressive disorder or dysthymic disorder, as was known before, where all the time you're feeling this downness. You can feel you're not yourself, you're not completely happy. Something is not right. You're just feeling down. You are teary here and there, but it doesn't feel as severe. And then at some point you start dipping. So that's what she did. She would dip into a major depression and then come out and then stay there at that persistent depressive disorder. So those are the different types of depression if you're looking for types. And as I said, it gets a bit technical. When it comes to our clients or our patients, it doesn't really matter what kind of type of depression it is. It just becomes a big issue to us as scientists. So when we come in to select what kind of medication we need to give you.
Yes.
Yeah.
Another question, Sis Boni.
Yeah.
The question now, to me, Siletela is asking that what if you had depression and you never went to seek professional help and you decided to ignore it, will it have an impact on your future?
It's so unfortunate that it will have, and in fact, for the mere fact that you are not dealing, that on its own is the problem, because you know that there is a problem, but now the ability, because on what I normally say to people is that the reason why people would rather seek alternatives in terms of maybe a person will have a habit, because we've got this perception that people end up being drug addicts because they want to. It's an escape. So there are various ways of escaping your reality. So in that person trying to escape, what they're actually running away from is confrontation, because the major part about confrontation is that you have to relive whatever trauma you went through, and you've been living this life trying to cover and cover and cover. But unfortunately, with time, it's going to impact on your mindset, because you will have, for instance, there is anxiety. So anxiety will come from that. And then the other one will have a paranoia. So you will have all these things which are not normal. You will try to fix them, but now you are not fixing the actual problem. You're fixing the symptoms of the problem. So this then means, as a person, it has to be part, like we have our GPs. That's what I normally say. That as a person that has a GP, have a psychologist in your list. A psychologist, a psychiatrist is part of your budget. Because at the end of the day, your mental health, all these other ills come from lack of maintenance of our mental health.
Wow, beautiful, beautiful. Auslerato Lemos, I don't know if you're back.
Machaka is back, Abuti Komeng.
Machaka is back. Machaka, please help us. The clinical side of it. We've heard from our psychologists. We've heard from our spiritual psychologists. We've heard from our psychiatrists. What do you deal with on the clinical side of this depression? Machaka? Okay. Auslerato Limosa is not here also, right? Doctor, types of mental illness they want to know.
Type of mental illnesses. So when it comes to mental disorders, we've got what we call CMDs, or your common mental disorders, and your SMDs, your serious mental disorders. So
Yes.
your common mental disorders are then your depressive disorders, all of them, your anxiety disorders. Anxiety as well, it's an anxiety disorder. You've got a lot of disorders beneath it. There's your
Yes.
generalized anxiety disorders, there's agoraphobia, there's panic disorder, there's OCD, there's PTSD, there's adjustment. So there's a lot of them under anxiety disorders. So those are then your common mental disorders, the ones that are not very obvious. And then you get your serious mental disorders. Then these are the ones that we see on people that are loitering in the street, who they are out of touch with reality. That's when you get your schizophrenia, your what you call substance-induced psychosis, people that smoke dacha or they use drugs and then they become what we call psychotic. Then you get your bipolar disorders. Those are then what you call the serious mental disorders. So it can actually be classified into those two major ones. So as I said, the mood disorders will be your depression or your bipolars. The bipolars are not people with mood swings, but it's those people that become manic, they don't sleep, they talk very fast, they have a lot of energy, they don't feel they need to sleep, and they have this what we call grandiosity. They have this inflated sense of self-worth, which is not true, which is not in keeping with what they do. If I go out and say, I'm a very good psychiatrist, then it could be in keeping, could be true. But now if I come and say, I am the best psychiatrist in the whole world, I can heal you just by looking at you, then that goes into grandiosity. So that is your bipolar patients. And then anxieties, as I said, they have different symptoms as well. And then your psychotic disorders.
Yo, cool, yo. How's your name?
Yes, Dr. Kobe?
Clinical side of this. Please help us.
Yes. Okay, thank you so much, Dr. Kobe. Once the person or a client experiences any of the signs and symptoms that the doctors have shared with us today, what you can do at home is that you can take the person to the nearest clinic. They can get services there for free. And what happens is that when you get to the clinic, or maybe when you get to hospital, what we call clinical picture or clinical assessment, where we ask all the questions that Dr. Tsiklava has mentioned, and there's blood also that we draw, so that when we refer you to a psychiatrist, they can check your blood results, and they can also look at the history that you give and the history that the family gives. And then in that way, it's easier for the doctors to diagnose and to treat the patient.
Beauty, 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 beauty. Doctor, they want to know what causes postnatal depression.
You know, when it comes to causes of psychiatric disorders, I've been doing this for a few years now, and there's no one person who can point and say, this is the cause of a psychiatric disorder. You must remember psychiatric disorders represent a chemical imbalance in your system. That is why you become psychotic, that is why you become depressed, that is why you become anxious. As Oslerato was saying earlier on, with the imbalance in your cortisol, the imbalance in your endorphins, in your serotonin, and things like that. So you get people that are at risk of developing postpartum depression. It's not everybody who will develop postpartum depression. So imagine how many people are in the world. So it means all mothers that gave birth will develop postpartum depression. That's not the case. So usually you find it's in people that have had depression before. You find that it's in people whose family, mother, grandmother, grandfather, whoever had depression. Or if there was social stresses during your pregnancy, around your pregnancy, the circumstances under which you fell pregnant, the circumstances of the pregnancy, the circumstances of the giving of the birth, like the social circumstances. For instance, if you're a single parent, the partner is not supportive, the family is not very supportive, and you are shunned or you're abandoned because of the pregnancy. Then you are at risk of developing postpartum depression. If there's poor social support, or if there is a history of substance abuse. So there is a lot of factors. Hence, we take about an hour and a half to interview a patient when we see them for the very first time, because we need to determine, we don't have a cause of mental health illness, we've got contributing factors of mental disorders, which can be your risk factor, then can be your perpetuating, your relieving, and things like that. So we look at factors, not causes.
Okay. Thank you very much. Thank you very much. It looks like our time has ran out at the moment, but do not forget that you can still pose those questions, and our professionals will help you. We will pass the questions to our professionals, and we will be coming back with answers. And do not forget that this Youth Mokete continues its hashtag Digital Youth Mokete, hashtag Youthfest 2020. Tomorrow morning, it's fun galore. Tomorrow morning, it's activities. It's going to be crazy. It's going to be amazing. Talent will be flying. So do make sure that 10 a.m. you crash with us. Adios, adios, and thank you very much to all our guests. Thank you for taking time off from your busy schedules and giving us time to say, let me go and talk with the youth from the Tranaras Apostolic Church. We're hoping that the time the lockdown ends, we will see you in physics. We will have discussions with you in physics. Adios, skadios. Osman Tolo, I'm out. And yes, do not forget to catch the apostle one-on-ones they just reminded me just now that do not forget to go and talk with the apostle. Call the office so that they can set you up with the one-on-ones. So, ladies and gentlemen, thank you for tuning in. Until we meet again, Modimo a le tlhagono la fatshe. Thank you very much.
Hallelujah. Bye.
Bye.
Amen.
Thank you, everyone. This was so interesting. It was so informative. Thank you.